Thank you for joining us. I wanted to send a message out to the people of Manitoba, given the very serious news that we heard shared to us by Dr. Roussin and Lynette Siragusa. And I wanted to begin by just saying to people in Manitoba, we are being put on code red here in the Winnipeg region. And I know many people out there are going to think about this as the red stop sign, meaning this is something that is going to impact them because we have to stop doing the activities that we love so much or socializing in the ways that makes life so rewarding and so fulfilling. But I want to encourage you not to think about code red today as a red stop sign, but rather think of the red heart emoji. And what I mean by that is this: the code red restrictions isn't about what's being put on me or what I'm being told not to do. Rather, what we are being asked to do today is an act of love. Abiding by the code red restrictions today is an act of love that we can all participate in to help the seniors in our province, to help the healthcare workers in our province to be able to get through this difficult time, to help the young kids in our province, the students, to be able to continue attending school. Earlier this year, I had a situation where a very good friend of mine was put in the intensive care unit. Now, this is somebody who's maybe just a few years older than myself, a non-native guy, but just like me, he's a dad. And he had his life saved by the ICU doctors and healthcare staff and the nurses in the ICU. But based on what we're hearing from Dr. Roussin and Lynette Siragusa today, what would happen to my friend if he got sick now? Would he be able to get the life-saving treatment that he needs? Unfortunately, our hospital system is hitting capacity. Our healthcare staff are burning out. And what that means for everybody in the province is that we should all be very, very concerned about our friends and our families and our loved ones and what's going to happen to them when they need life-saving medical treatment. So we ought to all bind ourselves together and step up and do what it takes to practice this act of love, this act of community, this act of helping one another so that we can all make it through the pandemic. When I think about what's being asked of us today, I think about my friend who was in the ICU earlier this year. I want him to live. I want him to survive the pandemic. You're telling me that if I wear a mask, you're telling me if I don't go out this weekend for Halloween, you're telling me that if I don't socialize outside of my household that I could save my friend's life? Sign me up. Sign me up. Is that all that I have to do in order to help the seniors in our community, the nurses in our community, the students to be able to continue going to school? Well, that is the least that I can do. And I think those are the conversations that I want to encourage Manitobans to have. If you're a 20-year-old today, a 25-year-old, you're a young person today, you're not being asked to go to Iraq or to Korea or to Normandy. You're being asked to wear a mask. That is the sacrifice that our generation and the younger generation is being asked to make. Stay home this weekend. Don't go to a Halloween party. That is a sacrifice that we're being asked to make. And I think it's one that we can all live up to. I'm very conscious of the fact that people sacrificed so that I could have the opportunities that I enjoy today. On my mom's side of the family, the non-native side, they fought in the world wars to give me the chance to stand here today. On my dad's side, the indigenous side of the family, they fought in the world wars. They went to residential school. They went through those tremendous sacrifices so that I would have the chance to stand before you today and do a job that I love. And so this is what is being asked of us in our time, in our generation. It is to put the needs of the community, to put the elders first, to put the seniors first, to put the students first, to put the nurses and the healthcare workers first, so that we might all see it through this pandemic, that we could all see through 2020 to 2021. Now, unfortunately, it is a very brutal truth that not everyone is going to make it through the pandemic. But our actions can today determine whether or not more people will survive the pandemic, whether or not more people will make it through the end of 2020 and 2021. And so that's what we need to do. History will record this moment in time. People will be talking about the COVID-19 pandemic for generations to come. Which side of history do you want to be on? I think we all want to be on the right side of history here in Manitoba. And so in those future conversations, when people are asking, what was the pandemic like? What was it like back then? And they ask, what did you do? I want to be able to say, I did what I could. And now I want you to do the same. And so we're standing here today to reiterate our total support for the public health of Manitobans, to reiterate our support for the heroic people in the healthcare system who at this very moment are saving lives even though they are being pushed to the brink. And we're here to reiterate our unconditional and undying love for the people of Manitoba. And so I'm joined today by my colleague, Uzoma Asaguera, who is our health critic and also the MLA for Union Station, because we want to do our part to help get the message out to Manitobans. And so with those few comments in mind, I want to invite Uzoma up to speak a little bit more about our response to today's Code Red restrictions.